Hi everybody, this is the Planet Earth here. Today I'm going to be explaining what an anxiety attack is and how it affects everybody that suffers through it. I'm going to explain it in a way that you guys can understand it even if you don't have anxiety disorder. Alright, so what is an anxiety attack? Well, let me explain. Okay, an anxiety attack can have these repercussions. The symptoms. Okay, these are the symptoms of anxiety attacks. Alright, to a person to whom it may concern, the person that doesn't have an anxiety disorder, this is what it will feel like. Alright, so example. To the person who doesn't have anxiety disorders that wants to watch this video, it's similar to jumping out of an airplane without the airplane or the jump. These are the symptoms that I have noticed. The symptoms that I have noticed myself and with millions of other people is the first symptom is a kind of fainty feeling. Another symptom is high heart rate, which comes on suddenly. I mean, you could jump from 60 beats per minute. You're looking at around 140 beats per minute. Maybe if it's a really bad anxiety attack, you might hit 176.5 beats per minute, sorry. And in a really bad anxiety attack, we're talking hardcore panic attack, you may hit 200 beats per minute. And it only lasts it can last from 5 minutes to about, you're looking at 2 hours. But you don't usually have a high heart rate for 2 hours straight. That usually comes down, but you're still panicking. It can spike up to 200, but it usually goes down within the first 10 minutes. Blood pressure will be high, in most cases. Will be high. Some readings you may get at a hospital or in an EMS vehicle. Jesus Christ. I don't know how to spell that. Vehicle. Yeah. Now I spelled it wrong. Who cares? Alright, EMS might actually... You might be looking at 200 over 100. You might, luckily, be looking at 150 over 100. It's during its burst 175 over 100. If you're higher than that, they're going to send you to the hospital. They're going to want you to go admitted to the hospital. You don't want to be over this. You definitely don't want to be over that. And you definitely don't want to be that. I mean, holy shoot. At that time, you're going to be exploding. But, mainly, the most blood pressure that I've seen that's standard is like 155 over 110. I have received blood pressure as high as 240 over 125. Now that one, I felt that, and I couldn't see straight. Now, EMS, you're going to get a high blood pressure reading. Period. The first thing that's going to happen when you're having an anxiety attack, and the anxiety attack is really severe. Alright, so here's what's going to happen. You're going to call 911, or if you're from the UK, below, or 999. I don't know what you're going to be doing, but either 999, 911, or 000. EMS comes, checks you, and either they'll calm you down or they'll take you to the hospital. The second thing they're going to do is they're going to shoot you with a benzyl or Visceral. I don't know how to spell that. I don't know if I'm spelling that correctly. Visceral or Benadryl. It depends on how long it's lasting. If it's not coming down, though, they're going to do blood work. But the feelings are dread, depersonalization temporarily. I don't know how to spell that. Depersonalization. I'm close, but that's not how you spell it. Depersonalization, you're looking at anxiety, abnormal thoughts, continuously while you're having it, feeling like you will pass away. That's the biggest one that calls 911, is passing away. You may have slight chest pain. You won't have it as severe as an actual myocardial infraction, chest pain. Don't automatically, I didn't spell that right, automatically panic. I don't care about spelling correctly. Automatically panic. Don't just panic automatically just because you're having chest pain. But first thing you're going to try to do when you're having the chest pain during a panic attack, are you breathing okay? That's the biggest one. Are you shallow breath? Like if you're like, if you're hyperventilating, but, okay, let me tell you something. When you're hyperventilating, I've done this before. When you're hyperventilating, you're going to feel like, you can feel all your movements in your body, but you can't feel your actual muscles. Like, it's the same thing as temporarily being paralyzed. Your nerves become numb. You don't feel it though. What happens is when you go for too long, you call it hyperventilating. And when you're hyperventilating, what's going to happen is, okay, when you're hyperventilating, you actually breathe more oxygen than your body can actually replace with carbon dioxide. So, since you have a lack of carbon dioxide in your body, you will actually feel like you're going to pass out, and you will pass out if you continuously to hyperventilate. Usually, well, when you do pass out from hyperventilating, you will get knocked the heck out, but when you wake up, your panic attack will be over, usually. So, if you're going to hyperventilate, try not to. If you can't actually catch your breath and you're like, if you're breathing normally but you still can't capture your breath, and you hold your mouth, hold your breath, right? Hold it. I don't care how hard you gotta feel. If you literally physically cannot, if you're like, you feel like, you can't breathe, you're like, like, your lungs are breathing in and out, but you actually still seeing stars. You'll actually start to see stars, and your vision will become black. Then you have an actual problem. But if you're hyperventilating and you end up passing out, that's a panic attack. That's not a heart attack. Remember, when you're having a panic attack, right? When you're actually having a physical panic attack, not necessarily a heart attack, you can have chest pain. You can pass out, depending on the severity. Another big thing that happens with panic attacks is, just the high heart rate. Are you having palpitations, though? Just because you have a higher heart rate don't mean you're having palpitations. Palpitations, okay, are skips of the heartbeat. Like, is it going dump, 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 or is it dump, da dump, da dump, da dump, da dump, da dump, 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 da dump, da dump, da dump, da dump, da dump, 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 dump? Is it lub dumping, or is it lub dump, 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 lub dump? Depending on the palpitation, if it is happening more than 3 beats per minute, if it's happening more than, I go with a general rule of my own, but if I do more than 3 a minute, I call ambulance, because I don't know if my heart rate's going abnormal or not. It has before. I really haven't had palpitations ever since I stopped. I get them occasionally, but they're very uncommon. I stopped getting palpitations when I stopped drinking tap water. I'm not joking. When I stopped drinking tap water, my palpitations ceased to exist. Now, I'll get occasional palpitation, like maybe once a day or less. Now, the reason I have them is because that is actually normal in a human body. You will occasionally get hiccups of the heart. It happens all the time. It could be scary, but it does happen, and is completely normal. Now, the actual panic attack can last for 5 minutes to an hour to 2 hours. You need to breathe, but don't breathe too much. Remember, if you're not having an actual heart attack, let me explain what it feels like. In most cases, sometimes you may have no chest pain, but you'll know if you're having a heart attack. The main one is you feel very uncomfortable. I mean, we're talking It is not. You may not have chest pain, but you're gonna feel really uncomfortable in most cases. It is like a house sitting on your chest. If you're symptomatic like that, you'll have actual chest pain, and it will be the most terrifying experience in your life, because that's your actual heart, your most vital organ besides your liver and your kidneys. It's just unneeded. You need your pancreas, you need your liver to live. That's what they call it, liver. And you need your kidneys. You have to have those three organs. Those are the most important organs, obviously. So if you're having an actual heart attack, trust me, it is way different than an anxiety attack. There is some similarities, except you're going to feel physically ill. Like, you're going to feel the worst, ugly, nasty feeling. Now, a panic attack is scary, but it's similar to a heart attack without the chest pain. Now, if you start having chest pain and you're not having a panic attack and you don't feel anxious, and it's really severe, then you need to get your butt to an actual hospital. But there are some circumstances where my heart rate just goes so fast, it's over 200 beats per minute, where I've actually had to stop and catch my breath, because my heart rate is going too fast to catch up. My blood is not able to pump properly when your heart beats too fast. That's why usually when you have a sudden abnormal rhythm, you want to go to a hospital so that they can shock it back to normal. I don't know why that happens. The human body is not perfect, but it does happen. Most cases you'll live. Many times your heart doesn't just stop. There's usually a bad reason why it does, but usually your heart doesn't just stop. It happens, but it's very rare. So just remember that, guys. Now, if you're having panic attacks, I don't recommend taking benzodiazepines. But if you're really bad, I would recommend taking benzodiazepines. But don't take them for more than 2 months, guys. Don't get addicted. I've gotten mentally addicted and physically addicted to these medications, and they suck. But mainly it's physical addiction. I've already come off 4 milligrams. I'm down to 1.5 milligrams. And I don't recommend taking benzodiazepines unless you have the worst kind of anxiety you can ever imagine. If you are worried about everything every day, definitely take the Ativan, lorazepam, the Xanax, the Alprazolam, your Valium, whatever. Take your benzo, your Xanax, and chill. Just relax, take a deep breath. Remember this, most people live very long lives, even with anxiety disorder, but the feeling is the most scary feeling in the world. It is like a medical emergency without the medical emergency, but it is scary, and it doesn't just stop sometimes. Sometimes you need to get assistance from mental health people. Sometimes you need to be admitted to a psychiatric unit to get the medication you'll need to stop the actual anxiety attack. And that would probably be a benzodiazepine. Unfortunately, some of the states here in the United States of America are extremely strict with benzodiazepines instead of just giving them to people who absolutely need it. Because some sort of mental illness is sometimes biological mental illness, and it cannot be cured by therapy. And that is a fact. I have tried the therapy route for many years, and it does not work on me. It's going one ear and out the other. I still have the panic attacks. It doesn't stop. I brought out some terrible things that happened in my childhood, and it still hasn't stopped. So just remember that, guys. Remember how you can treat your anxiety. If you really have bad anxiety, get mental health and stop wasting time with yourself and suffering. There's no need to suffer. It's 2016. As of this video, the future is about 3 years away. I say by the year 2019, we're definitely going to be really advanced. And you know what? One of these days, they're going to cure the anxiety without actually, not allowing you to have adrenaline. Beta blockers in some people work really good for anxiety, because what happens is it actually blocks adrenaline, or some of the adrenaline. So that will also help with panic attacks suddenly too. If your body has a problem with your adrenal glands, yeah, you can have a lot of panic attacks for no reason. So just get checked out. If you feel that one of your medications giving you shortness of breath, or you feel something like that is causing your panic attacks, change it. Don't beat around the bush and say, I don't care about the medicine, what they give me. Make sure you look at the side effects. That's a big one. If you're experiencing anything, stop, take the medication, and get another one that works for you the best. But it's better to not be on any medication, to be honest. If you don't have schizophrenia, and if you don't have multiple personality disorder, I would recommend not to be on any medication. If you don't have to. If you're bipolar, I would just recommend a anti-seizure medication, but that's about it. I wouldn't recommend anything else. You don't need it. So anyways, if you have anxiety, ask for a benzodiazepine. If you can't get that, get a, I don't know, maybe get some Vistral or Benadryl or something to try to calm you down just a little bit. Calm that brain down. If you live in a violent environment, if you live in a scary environment, maybe not necessarily family violence or friend violence, move the fudge out and get yourself your own place. Get away from violent people. That's the biggest one. If you can get away from violent people and violent environment, your anxiety will increase at least 30%. It'll be less severe. Anyways, thank you guys for watching. This has been the Planet Earth here. I hope I talked to you guys very well.